Now BOERICKE. See BOERICKE Mathematica. BOERICKE extensively used rare and small remedies and gives us a clinical essence of those drugs. And what CLARKE has contributed, that CLARKE has turned that clinical essence into a clinical drug picture. And if you read Allen Encyclopedia and Herring Guiding Symptoms, they have also elaborated rare drugs very beautifully. So you see, our homeopathic forefathers, they extensively proven rare drugs to the deepest level. But we still want to read only 50 to 100 drugs. We only practice on 50 drugs like sulfur, thuja, calcarea, natramur. And in this jostle of finding the polycrest or finding the constitutional remedy, many of our patient leaves us. Why they leaves us? Because they did not get what they wanted to come here. So what they want was the cure and the relief, but we were unable to select the clinical picture. We gone to find the constitutional, we get the error, and patient left us. So again, this was a case from the rare drug, a case of diabetes mellitus and hypertension. In this case, you see HbA1c, glycosylated hemoglobin, is 7.8, and average blood glucose is 177, and blood pressure was 160 by 100. In this case, the main thing what I observed in the case was the extension of symptoms, extension of the pain. It is hypochondriacal pain extending to back, inguinal pain extending to leg, abdomen pain extending to arms, chest, finger and toes to the distant parts of the body. Just like capsicum, when capsicum coughs, it feels pain in the distant part of the body, but it's only when it is coughing. In this case, it was going automatically through some neural route. And pain in the kidney extending to arms and chest, lumbar pain extend to legs, cervical pain extend to scapula, and numbness of fingers extends up the arm. All these symptoms were, when she got all these symptoms, she went for the doctor and she was eventually diagnosed with hypertension and diabetes. She was not known of it. So in the KNERR repertory, we see, this is the abdomen section of the KNERR repertory. We see abdomen pain suddenly shift and appear in the distant localities such as fingers and toes. The only medicine we see here, diascoria. So again, I was struggling in this case in the starting, and when we gave diascoria, the second day patient said, all my pain, I have relief in all my pains, about 50% after the first dose. So we continued the patient up to the next 2 or 3 months, and after 5-6 months of treatment, we see here the glycosylated hemoglobin reduced to 6.3, and the average blood glucose came down to 134, and fasting sugar also came down to 112. So the medicine was diascoria. So, and you cannot, and the what is the interesting thing in this, that diascoria didn't had the rubric of and didn't covers the hypertension, either diabetes. It does not to clinical condition, but still upon the local symptoms we prescribed and the modalities we prescribed, and the patient was cured. And the extension of pain was, when I saw in the Herring Guiding Symptoms, all